Kenya, like other nations in the continent, recognizes that health and nutrition are cardinal in fostering and sustaining the well-being of our society. Ladies and gentlemen, the need to focus on the health, wellness, and nutrition of the population is born out of the reality that health access, affordability, efficiency, and responsiveness have been a challenge for many years. Our citizens are not only limited by the long distances they cover to be able to access facilities in far-flung and rural areas of our country, but also there is the challenge of the high cost of health services. Access, therefore, and affordability to specialized services are higher than most taxpayers can afford. These specialized services are often localized in particular facilities or towns such as Nairobi, such that ordinary citizens face a double challenge of traveling long distances in times of health distress for critical services. The double jeopardy is in having to cover long distance while you're unwell. We know that health disparities exist, with rural populations more vulnerable to undernutrition and infectious diseases. Our nation is facing the challenge of sustaining our health system against unpredictable global health dynamics. But pandemics like COVID-19 have proved that contemporary systems must be bolstered to withstand unprecedented times. Investing in technology and research will certainly go a long way in mitigating on the impacts of unforeseen health threats. As such, the government of Kenya continues to invest in modern technology, especially in medical infrastructure, which is core in diagnosis and treatment. I am aware, distinguished guests, ladies and gentlemen, participants, that this conference will also examine the sustainable practices within healthcare systems, encompassing environmental considerations and resource management for improved service delivery. Prudent environmental and resource management is a gateway to ensuring sustained provision of quality health, and as accordingly, digitization of health services and facilities is an integral part in optimal resource utilization as it enhances accountability and fosters a culture of stewardship. Distinguished guests, ladies and gentlemen, nutrition and health diseases in Kenya today are shaped by a combination of factors, including dietary habits, socioeconomic challenges, and access to health care. Malnutrition remains a major public health issue, with both undernutrition and overnutrition affecting different segments of the population. So nutrition and health diseases, as I've said, in Kenya today are shaped by a combination of factors, including dietary habits, socioeconomic challenges, and access to health care. Malnutrition remains a major public health issue, with both undernutrition and overnutrition being problems to different parts of our, or segments of our population. Children are mostly affected in terms of undernutrition. This is driven by food insecurity, poverty, poor maternal health, and inadequate access to diverse and nutritious food. On the other hand, we have the problem in the same city, same country, of overnutrition, with an increase in diet-related non-communicable diseases like obesity, diabetes, hypertension, and cardiovascular diseases. These are more common in urban areas like Nairobi, where processed foods high in sugars, fats, and salt are readily available. We also face a high burden of infectious diseases, including malaria, tuberculosis, HIV and AIDS, which continue to increase the health burden of our public coffers. One way to ease our financial burden is therefore to focus on preventive measures. President Ruto's administration is focused on improving the nation's food security, nutrition, and health care. Universal health coverage, UHC, currently being implemented is part of the broader strategy to provide accessible, affordable, and quality health care for all Kenyans. UHC also aims at expanding health services to undeserved areas or underserved areas through integrating digital solutions to streamline healthcare delivery. The government has made significant progress in increasing access to health services through its partnership with county governments, local health providers, and the private sector. This includes in the rollout of the Social Health Insurance Fund, SHIF, which offers comprehensive coverage, including outpatient service, preventive care, chronic disease management, and specialized treatment. It also increases improved efficiency and accountability in the healthcare service delivery. To improve accessibility to healthcare services, the government will continue to upgrade health facilities across the country, especially in rural and underserved areas, even within our cities. Similarly, we look forward to enhancing digitization of health services across the country. We call upon county governments to continue collaborating with the national government in the provision of affordable and accessible health services to the people of Kenya. Further, the Kenya Kwanza administration is keen on strengthening primary health care systems through harnessing the capacity of community-based services, preventive care, health education, which are essential in reducing the burden on tertiary and referral hospitals. And I think Governor Sakaja has said it. If we invest more in preventive health care, we will have fewer people going to hospitals because right from home they can access medical advice, medical education, preventive medical information for preventive care, and therefore it will be needless. Some of the interventions will help these people prevent going to hospital. And if they go to hospital, it's likely to be at level 2, 3 kind of hospitals, and therefore the bigger facilities will be reserved for complicated, chronic, and serious ailments.